Right, so then what's the purpose of doing an assessment? And if you notice, I think that's one of the ones that's on your green sheet. So do you think this is something you need to know for class? Probably. So you're going to understand it from 2 points of view, from the patient's point of view and from the examiner or the clinician's point of view. So you're going to understand the patient's problem from the patient's point of view and the clinician's perspective, and then to understand the physical basis for the signs and symptoms. Okay, so that's what this is, S and SX. So anybody know what's the difference between a sign and a symptom?
Symptoms, what the patient's experiencing, and a sign you can measure or you can observe.
Right, so the symptom is what the patient is experiencing or what they relate to you. And that's basically what's considered subjective. And then signs are what you can visually or palpatorily find on the patient. So a sign is something objective where you're going to be able to visualize it, whereas symptoms is what the patient describes. So when you do an assessment, it's pretty much going to be, you want to make sure you don't miss anything. So you're going to have a systematic way of doing it. And you're going to pretty much try to follow that same program every time so that you have a pattern of how you're going to do it. All right? And it's going to vary a little bit depending on what type of condition the patient presents with. All right? So you're not going to, if somebody complains of lower back pain, you're not going to evaluate their little finger. Right? You're going to vary it a little bit. But there are going to be certain things that you're going to pretty much do on a consistent basis with a patient. For example, like usually I'll pretty much always do cervical range of motion, lumbar range of motion on pretty much anybody. Okay? And then obviously if it's a certain extremity problem, you're going to do range of motion of that extremity. But there'll be certain basic things that you're going to do on a consistent basis, and then there's going to be other variations. History. So you want it to be organized, comprehensive, and reproducible. And then you're looking for subjective responses and objective findings. So when you're doing this orthopedic test, you're looking at if the patient's able to do that motion, but you're also looking for what type of subjective, subjective findings of what kind of symptoms or pain that reproduces. So when you're doing a certain orthopedic test, let's say if you're pressing down like this, it means two different things if the patient says, I have pain in my neck right here, or if they say, I have shooting pain going down my arm. Okay, that's going to indicate two different things as far as the diagnosis. So now, this is when you talk about how you're making medical records, this is a thing that's typically used. Now, is this another thing that's on your little sheet there? So, is that something you want to know? So you have SOAP notes. Basically, that's what's called. When the patient comes in each visit, you write in the SOAP notes. On the first visit, you do an exam, you're going to have more detailed notes. But at some point, you're pretty much always going to follow this basic format of SOAP notes. So again, subjective, that's what the patient describes to you. Objective are things that you're going to find or observe or measure. And then assessment is basically your diagnosis or your differential diagnosis. So assessment is, okay, this is what I think it is. Plan, that's what are we going to do about it? Now when you do the examination, previously in the notes you just used to say HOPS, H-O-P-S. But a lot of times people wouldn't remember all these other things, so I've expanded it so you have H-O-R-P-N-S. So first you're going to do history. And when you're doing a diagnosis, it's like you're aiming at a target. The goal eventually is to get right here in the middle. But first you're starting out with the history, you're taking a wide, broad view of the situation and getting the whole story behind it. But you'll find that taking a good history is probably the most important thing to get you to the diagnosis. You got to cover all the different things that are related to that. And then we'll talk more about different formulas of making sure you ask all the right questions. And then observation, that's basically your exam. As far as just visually, before you start laying your hands on the patient, you're doing observation, you're looking for things like swelling, discoloration, deformities, posture abnormalities, weight bearing status, antalgia, things like that. And then range of motion. Now, in some cases, people will do palpation first before you do range of motion. But the thing is that, let's say, for example, somebody has a shoulder condition, and you go in there and you palpate, and you're getting deep into the areas that are inflamed and irritated, and now all of a sudden their shoulder hurts more. Is their range of motion going to change? It could. So what you want to do is you do your range of motion first, and then you go into, I mean, there's two different types of palpation. You can talk about more of just like an assessment, evaluation type of palpation where you're just saying, okay, is it swollen? Is it red? I mean, is it hot to the touch? Things like that, where it's more like superficial. And then there's deep, more of a provocative type of palpation where you're going in and assessing the tissues and saying, okay, is that tender? So you don't really want to do stuff where you're eliciting tenderness until you've already done the range of motion. Because basically it's like if I'm examining the patient, you do the history, you do the observation, you gradually, like I say, you're zeroing in. So now you do the history. So that kind of eliminates some conditions and it focuses you more on others. Okay? And then it's like you're coming in from the patient. First you start from just talking, and then now you're going into observing, and then range of motion is done more as observing. So gradually you're getting zeroed in, and then the final steps are going to be when you're starting to put your hands on the patient. And then we'll talk more about range of motion, but basically, with range of motion, there's the 3 Ps. Okay? There's the planes. If you remember, what are the different planes of the body? What's this one? Sagittal. And then, what's this one? Coronal or frontal plane. And then transverse. Okay, so you're going to talk about range of motions. First you talk about the 3 different planes. And then there's going to be oblique planes, or different planes, and we'll talk more about those, like the plane of the scapula and things like that. And then you have paired motions. So there's usually a pair of motions that occur in one plane. Okay, what motions occur in the sagittal plane? Yeah, flexion and extension. And then in the frontal or the coronal plane, what's that usually going to be? Abduction, adduction. And then what's in the transverse plane? This, rotation. Okay? So you have the 3 Ps. First you have the planes, then you have the paired motions, and then you have the progression of how you measure range of motion. First is active, then passive, then active resistant. I think that's written later in the notes, but I'll cover it now. So then palpation, basically that's when you're going to be going in and getting your hands on the patient. Okay? You're going to be checking for tenderness. Then you're palpating for deformities, different things. We'll go through all the details later. And then you have neuro things. Okay? When we talk about, quote, a neuro test, then we're primarily talking about a lot of stuff you did in ONE2, dermatomes, myotomes, reflexes. Okay? There's going to be special tests that are going to evaluate nerve tissue, but they're still really going to be considered special tests. When we talk about neuro, we're talking about things like dermatomes, myotomes, reflexes. There are a few things where we, different tests where you're doing like this, where you're watching for the arm drop and things like that. But then there's other neuro special tests where we do like straight leg raise, where we're trying to traction the nerve, and we do the Tinels. Those are more or less special tests that evaluate nerve tissue, whereas you have neuro, like what we call the 5-minute neuro, which is going to be dermatomes, myotomes, reflexes.